Hello, my name is Connie Vokoun. My topic today is on assisted suicide should be legalized for Alzheimer's patients. The reason I chose this topic is because I work in an in-home care agency with an in-home care agency, and most of our clients have dementia or Alzheimer's. This disease destroys the brain. The cost of care is very expensive, and the patient should have the right to choose whether to suffer or not, since death is inevitable. Alzheimer's disease is a progressive brain disease. The disease slowly destroys memory and thinking skills. Everyday living tasks are lost. No drug or exercise will prevent or regenerate the brain cells that have been lost. The brain will continue to shrink half the size of a normal brain. And I will demonstrate. This is the size of a normal brain. This is the size of an Alzheimer's brain. And here's the difference. Let's talk about the memory loss. Memory loss is all past, present, and there will be no future memory. Your family, your friends, all become strangers. Their names, you will never remember their names. Thinking skills, everyday, daily task. Eating, you will not remember to eat or how to eat. You will not be able to dress yourself. You will not be able to take a bath. You will not be able to go to the restroom. And you will not remember how to chew your food. Then eventually you will not know how to breathe. So the death sentence, you will pretty much suffocate. Also, violent behavior can be very uncontrollable because all the communication is lost between you and your Alzheimer's patient. 65 years old is the magic number. If you make it past 65, chances keep increasing that you will develop or have Alzheimer's disease. Somewhere in the world, every 7 seconds, someone will be diagnosed with Alzheimer's disease. Of that, 5.2 million Americans in 2014 were diagnosed with Alzheimer's disease. To better understand this disease, it's not a part of aging. There were used to be 4 stages, researchers reported. Now, through somewhat research, there is now 7 stages to the disease, leading up to 10 years you can live with this disease. And I do want to remind you that Alzheimer's is a death sentence. Let's talk about cost. Federal funding allocates cancer $5.4 billion a year. Heart disease, $1.2 billion a year. HIV and AIDS, $3 billion a year. Alzheimer's research is left with $566 million a year. The cost to take care of an Alzheimer's client costs more than most families make, leaving them in bankruptcy, especially with 24/7 care. Alzheimer's is reported the most expensive disease in America. The Alzheimer's Foundation has reported it can cost a family anywhere from $18,000 to $36,000 annually to care for an Alzheimer's patient. I'm in the in-home care business. On one-on-one care, it will cost $6,000 to $7,000 a month. Then we got Medicare and Medicaid facilities. You put your family member in there, they'll be in a lockdown unit, probably as large as your living room. And they will be put in a wheelchair, and in the evenings will be drugged. because there's not enough help in the facilities for one-on-one care, so they drug them. What about the caregivers, the Alzheimer's patients? Usually family members, and it's usually the women that take care of the patient. The toll it takes on caregivers are reporting in, they're thinking about committing suicide themselves because they're in so deep depression, poor health, and the stress level, and including financial. Caregivers are dying before the Alzheimer's patient dies themselves of the disease. What are your choices? What will be your options? Assisted suicide is one option. Or you can stay at home and take care of the Alzheimer's patient yourself. Detected early enough with the Alzheimer's disease, you still have enough logic to understand the disease, and you can also write your own living will and appoint someone to be your power of attorney to decide when it's time for you to have assisted suicide. Patients can choose to die before their dignity is taken away from them. There are a few places around the world that assisted suicide is legal. Oregon, in the United States. Janet Atkins, age 53, diagnosed in 1990. She chose to assisted suicide when she was diagnosed with Alzheimer's. Switzerland, Netherlands, and Belgium are your other three countries. I do want to remind you again, currently there is no cure for this disease. So why put your family through this? Choose assisted suicide. Should be an option. There will be always political debate over humanitarian rights. It's called control. Who decides? Religious, of course, is always going to be there, and moral issues. When families can no longer take care of their family members with Alzheimer's, they will be wandering the streets. We will all have to decide one day, dignity or not. I'm going to sum this up. Alzheimer's is on the rise. There is no cure. It is a death sentence. This causes financial, mental illness to families. The funding is not there. Assisted suicide should be legalized. Thank you.